We began with more evidence that the opioid crisis continues to be a problem for our area.
Two of the people involved were medical professionals who investigators say had easy access to powerful drugs. Lisa Dothet worked as a pharmacy technician at a Walgreens in Bryan County. Today, she was sentenced to 3 years in prison for stealing oxycodone and hydrocodone from her employer.
24-year-old Jamie Mays is a former medical assistant at a Bryan County pain clinic. She is awaiting sentencing after pleading guilty to stealing Percocet and oxycodone. Prosecutors say that Mays stole the pills and her boyfriend, 24-year-old Reginald Lee, sold them. Lee has also pled guilty.
Two separate cases with one common denominator. Both involved medical professionals contributing to the opioid crisis. News 3's Martin Staunton is here with what federal investigators are saying about what some see as a trend and what can be done about it.
Good evening to you, Ben, and to everyone out there watching. The Federal Opioid Enforcement Coordinator says investigating local impacts of the opioid crisis requires cooperation. And he says the public plays a key role as well, especially when it comes to finding medical professionals who are putting opioids on the streets instead of in the hands of patients.
We find out in a variety of ways. One of the most important ways we find out is from the public.
Federal Opioid Enforcement Coordinator Matthew Josephson says it's tips from the public in many cases that lead to medical professionals' arrests in the ongoing opioid crisis. He says this insider involvement is uncommon.
We're talking about a very select few medical professionals. The vast majority of medical professionals are law-abiding citizens who very much take their responsibilities seriously.
But those who don't will be found and held accountable.
Our office has reached out to every major hospital in the Southern District of Georgia and asked them to help us with any information they may have about the illegal diversion of prescription opioids.
Overall, the opioid crisis is hitting Chatham County hard, making it home to one of the worst epidemics in Georgia.
Outside of Metro Atlanta, that's correct. Chatham County and Richmond County are the two counties with the highest incidence of opiate misuse last year. These pills are highly addictive, and the people who take them often can start taking them for legitimate purposes.
Josephson says that's why it's a particularly bitter pill to swallow when medical professionals cross the line and contribute to the illegal diversion of opiates.
Medical professionals play a key role in the opiate crisis that we're facing as a country because they effectively operate as gatekeepers for these prescription drugs.
Josephson adds that each arrest and prison term may save someone's life because opioids are the deadliest drug crisis in U.S. history, claiming 132 lives a day in America every day last year, and scores of people have died from those overdoses here in the Coastal Empire. Martin Staunton, WSAV News 3.
Martin, thank you.